Brain tumor versus headache. Spotting the red flags. Headaches. We've all had them. That throbbing pain in your head can be distracting and debilitating, but it's usually short-lived and treatable with over-the-counter medication. But sometimes a headache can be a sign of something more serious. One of the most common concerns I hear from patients is whether their headache could be a sign of a brain tumor. While most headaches aren't caused by tumors, it's important to know the red flags. In this video, we'll explore the key differences between a typical headache and one that might be caused by a brain tumor. Progressive and persistent. One of the most telling signs of a brain tumor-related headache is its tendency to worsen over time. These headaches are often described as progressive, meaning they increase in intensity or frequency. Another red flag is the persistent nature of these headaches. Unlike tension headaches or migraines, tumor-related headaches often persist despite taking medication. If your headaches are becoming more intense, frequent, or not relieved by usual remedies, consult a medical professional. Worse in the morning. Waking up with a headache that's worse than the day before can be a warning sign of a brain tumor. During sleep, increased blood flow to the brain can elevate intracranial pressure, intensifying headaches. As the day progresses, gravity helps reduce this pressure, easing the headache. If morning headaches improve as the day goes on, seek medical advice. Associated with vomiting, nausea and vomiting can be red flags for a brain tumor, especially when they have specific characteristics. Projectile vomiting, which is forceful and not preceded by nausea, can indicate increased intracranial pressure. If you experience this type of vomiting with headaches, seek medical attention immediately. Chapter 4. Changes in mental status or personality. The brain is a complex organ responsible for our thoughts, emotions, and behaviors. A tumor can disrupt these functions, leading to changes in mental status or personality. Sudden confusion, memory problems, difficulty concentrating, or personality shifts could be warning signs of a brain tumor, especially with new or worsening headaches. Persistent changes in cognitive function or personality should never be ignored. Chapter 5. Neurological deficits. Neurological deficits are problems with your nervous system's ability to communicate with your body. Sudden deficits like new-onset seizures, changes in vision, difficulty speaking, numbness or weakness in limbs. These are not typical headache symptoms. Seek immediate medical attention if you experience these symptoms. Chapter 6. Worsens with Valsalva maneuver. The Valsalva maneuver is something we do naturally without even realizing it. It involves forcefully exhaling while keeping your mouth and nose closed. This action temporarily increases pressure inside your chest and head. For someone with a brain tumor, this can worsen headache pain due to increased intracranial pressure. If your headaches intensify during these actions, discuss this with your doctor. Chapter 7. Headache in someone without a history. New-onset headaches in certain age groups raise concern. If you're over 50 and experience new headaches, get checked by a medical professional. Early detection is key, so seek medical advice at the first sign of unusual headaches. Outrow, stay informed, stay healthy. Headaches are incredibly common and in most cases, they are not a cause for serious alarm. However, certain red flags could indicate a more serious condition like a brain tumor. It's essential to be aware of these red flags and pay attention to your body. If you or someone you know is experiencing any of the symptoms we've outlined, especially if they are new, persistent, or worsening, seek medical attention. Early diagnosis and treatment are crucial for the best outcomes. Stay informed, stay healthy, and never hesitate to reach out to a healthcare professional.